Welcome to another upper cervical clinical case review. I'm your host, Dr. Chris Brown, where today I will be going in on a woman who had been dealing with jaw pain for 4 years that was so severe she had to drink food out of a straw, and the evening after her first adjustment, she ate a steak. You heard me. She called me the next day and said she ate a steak, and I'm like, oh, what are we doing? And here's the story behind that. So this woman was referred to me by a mom I had been taking care of who had also been dealing with joint pain. They're in the same book club, and this woman was talking about how her jaw, neck, stress, anxiety had gotten had a big positive change going through care. And this other lady was like, jaw issues, like I've been trying to figure that out for the past 4 years. She's like, well, check this place out. So she gave us a call. She gave our office a call, and she reached out to us, and we were able to get her in for a consult. She told us everything that she had tried. She had gotten a ton of imaging done, like Botox injections, been on medicine and pills for nerve pain issues and muscle relaxers, but nothing was really helping. And when I hear that there are long-term issues going on that have not responded to traditional medicine and care, that typically indicates to me that there is an underlying functional issue going on, and more than likely the culprit is in the nervous system and the person didn't even know it. And so step one in that scenario, which is actually very common, is we need to do a functional nervous system test. We need to actually see what's going on with this, with the nervous system, and we need to be objective about it. And so being able to take that test, luckily we do that in the clinic, gives us a really great insight into the status of this person's nervous system, and also confirms to us whether or not we're confident that we'd be able to get results. So this lady, she was able to come in, ran a few nervous system tests on her, and we confirmed that there is an underlying issue with the nervous system that's causing it to essentially malfunction. And that gives us confidence that, or confirmation, that we're going to be able to help this person out. When we see a nervous system on our scanner, that test is called computerized infrared thermography. Basically, like how an EKG measures heart function, this just measures nervous system function. When we see stress indicated on that scan, and we see that the nervous system is in a state of dysfunction, that confirms to us that there is indeed a misalignment of either the first or the second bone of the neck. And from there, we have a process that is able to determine what is the culprit unique to you, and what do we need to do to unravel this stress and put your body back in a place of healing. The whole reason why we go to the nervous system first is because our body's capability of healing itself is rooted in the nervous system. So there's 4 pieces to that. I say this primarily in almost every video because this might be the first video that you have watched. But our 4 pieces, okay? So number 1 is that our body's capable of healing itself. I have yet to find someone that disputes that. If we cut open our knee playing capture the flag, it's going to scab up. If I strain my hamstring playing soccer, it's going to heal up. Now, those healing codes are not just exclusive to my skin and muscle, but they're all inclusive to every single cell, tissue, muscle, organ in the body. Those healing codes come from our brain and are communicated via nerves, making brain-body communication of the utmost importance. If there's anything interfering with that brain-body transition site, then it makes sense that chronic health issues might stack up over time presenting as symptoms, because the healing codes created by my brain are not actually getting through to my body, nor are they getting to their end target. And what we find consistently is that these top 2 bones are oftentimes that culprit that is preventing our body from being able to receive those necessary healing codes and be able to essentially live at max capacity as often as possible. And that was a big case with this lady who had been dealing with such severe jaw spasming, tightness, and nerve issues for 4 years that she could barely open her mouth. She was essentially trying to talk like this. She couldn't open her mouth wide. And that's part of our x-rays, is we have to do images with the mouth open to be able to get the teeth out of the way so I can see the anatomy I need to in the back, which is part of our x-ray analysis. And with her, we had to do the best we can because she essentially was only able to open her mouth like this versus the typical orientation that I need, something like that. And so I had to like really angle the x-ray beam in a pretty precise angle, and also have her head oriented in a way where I was able to actually get the bones, because her teeth were only offering such a sliver of room to really visualize what's going on with the upper neck. But what we had found on that, after we took her scans, found out that she had stressed out nervous system, confirmed to us there is a misalignment of the upper neck, did an orthopedic exam, also did full spine scans, and then we went and shot x-rays. What we saw on x-rays was that her head was essentially way over here. It was like, this was her neutral, was like this. And so gravity is acting straight down, and her head is like this, which means that her body essentially is going to go here to try to compensate, or it's going to try to bring the head somewhat neutral to try to compensate so I can still see the world horizontal. And that gravitational shift puts a ton of stress on that jaw joint on that side, because now instead of my jaw, especially if she's initially like this, my jaw biomechanically wants to track still in this line. It wants to just go straight up and down. But if I'm here and I'm trying to see the world still horizontal, it's going to start tracking down like this, which puts a lot of stress on really both sides. In her case, it was manifesting on that left side, especially because there's way more gravitational pull going on here. And all these muscles have to work way harder to try to stabilize the TMJ, temporal mandibular joint right here. And it has to work way hard to be able to do that. So those nerves are firing more chaotically, those muscles are seizing up, and it's really locking that jaw down. And since her head was so far over to the side like this, it was putting such extreme stress on that side of her jaw that it was causing her muscles to spaz up in a way where she couldn't even open her mouth. And she was like, I have to eat liquid foods. I can't open my mouth. I'm stuck to resorting to basically drinking my foods through a straw, which I have never heard of someone having to do that. And she had to resort to that just over the past, I think, maybe several weeks, over this kind of 4-month stretch of her jaw worsening. And what we found on x-ray was that her second bone of her neck was very far shifted to the left and had basically backwards movement going from left to right. In our x-ray analysis, what we do is we do motion films that allow us, that basically give us insight to how these two bones are moving, because incorrect movement is what causes the stress on the nervous system and basically spasms the nervous system out. So we know what correct motion is supposed to be. We're able to see what the incorrect motion is, and that tells us what this adjustment particular to this person is going to need. And for her, she had this second bone was shifting very far to the left. Also, her top bone was also not going from left to right. And also this top bone here was rotated like that. So she really had this kind of a combination where these two weren't moving. And so when we were able to, when I gave her first adjustment, it was this second bone on the left, pretty much in just a translatory fashion, and being able to address that and have the top bone also left part go with it. So the whole mindset with our adjustment is a hole-in-one concept, where imagine golf, where I'm looking at the green over water, and most people are going to use a driver, iron, chip, putt to get the ball in the hole. I'm looking at the green and I'm trying to figure out in my head, how can I hole-in-one this in one shot? And that's what we're trying to do with our adjustment here, is we're trying to have a hole-in-one adjustment that unlocks the entire spine and thus the nervous system. So with that correction that was given to her, I mean, it wasn't like anything special. I mean, it really wasn't a memorable one, but it created memorable results in that moment. But I mean, you know, in terms of how do people respond from their initial adjustment, really it's 3 buckets. 80% of people don't really have a big change. They're like, okay, that's it. They go about their day, they go about their evening, go to bed, go to sleep, wake up. Not a whole lot of change coming out of the gate. It's because nerves take a long time to heal. This isn't a bone, this isn't a ligament. Bones take like 6 weeks, ligaments take like 12 weeks. Nerves take about 6 months. Nerves take a long time. And we're trying to heal your spinal cord, really, is what we're trying to get at. From brain all the way down to your hips of your spinal cord. That's what we're trying to actually objectively see heal and restore function to. And that takes time to do. So 80% of people don't experience a whole lot of change after the first adjustment. 10% of people, they feel like they just worked out for the first time. They might be kind of sore, kind of groggy, kind of tired. And that's primarily because it's their first time that their body's starting to work in this way, and new muscles are working in ways they haven't in a really long time. Most people we take care of have been having issues, I mean, for about 5, 10, 15, 20 years. The longest I've seen is 45 years of a complaint. So to try to get that stuff unraveled in weeks to months is a pretty tall expectation. But it is one that we achieve quite often. But in terms of an initial response, that is 10% of the cases. The last 10% of the cases, it's like everything is gone within a day. It's pretty... I don't want to say miraculous because I've seen it happen, but it's pretty crazy when that does, because it always humbles me towards being able to really just get reminders of how powerful our nervous system is, and that I'm literally working with the brain and this person's capability of healing itself, and I'm just a conduit towards restoring that, but really it's her own body that's doing all the work, all the restoration. It's not me. And so whenever those kind of scenarios happen, it's always very humbling for me to just see and observe and hear, because it's not my life that's being impacted, it's this person's, and it's not my action that's doing it, it's this person's body that's doing what it's been capable of this whole time. So I get a call the next day, and she's like, hey, I just want to let you know, I ate a steak last night. My jaw wasn't hurting. I wasn't having the spasms. I was able to open my jaw, and I was so excited that I told my husband, let's go get a steak, because I want to eat it, because she hadn't been able to in so long. And I was super stoked for her. And that was just a really cool story of, I mean, you don't really know what these people are dealing with. You really don't know what people are navigating through. Like, you would have never known that if you just crossed paths with this person in the grocery store, that she's eating food through a straw, or maybe that, shoot, yesterday was the first like solid food she ate in months. You have no idea until these people start sharing what kind of struggles that they're dealing with. And that was just a really cool story to have something that drastic happen that quick, because that's not often the case. That was a really humbling story for me, and a really powerful one. Just a testament to upper cervical care, a testament to nervous system health, a testament to what our body's capable of doing when it's in proper position to do so. So I'm really grateful for that opportunity to be able to provide care for that person. And I hope that she's still doing well, and I hope that her story inspires others who deal with head, neck, jaw pain to go seek out upper cervical chiropractic, nervous system health, and hopefully experience the same change in well-being that this woman did. And so if there is an opportunity to get your nervous system tested, whether it's here or a place near you, please take action and do so. It is the best investment you could possibly do for your own health, vitality, and longevity of you and for your family. It is the test that I think every single human should have upon birth, and every single doctor visit, hospital visit, everywhere should have these tests, because it is the most impactful information you could ever receive. So please do so. You'll thank yourself. I'll thank you too. But with that, I'm going to sign on off. Thanks for tuning in. Please subscribe if you haven't already. My name is Dr. Chris Brown, and we're just getting started.